Welcome everybody on the panel and welcome everyone who is watching. And my name is Mayank Joshi. A lot of people know me simply as Joshi. I am the founder of GIN, the Gained Network. My pronouns are he, him, and his. And I'm in a good mood. I'm really happy, very cheerful, a little bit lively, of course. But this is a serious topic. This is serious, very serious. I was really pleased when we were asked to get involved in this group by Brixton Reel and Carrie. We need to get this information together. We need to get it to the right people. We need to have the right people on the panel to be discussing this. So I'm really happy you are all here today. Let me say a couple of things about this event. Welcome to our South Asian Queer Wellbeing webinar, hosted by Brixton Reel. Thank you very much for joining us tonight. Tonight's event has been commissioned by Thrive LDN and produced by Brixton Reel Film Festival. Thrive LDN are looking to find out how COVID-19 has affected the South Asian queer Londoners, South Asian queer community. So I've commissioned a survey to better understand our experiences. The purpose of this discussion is to help us understand how the COVID-19 pandemic and lockdown has affected South Asian queer folk. The plan is to go through the questions, and there are 10 questions. Many of you have probably seen or have even done the panel. There are 10 questions in the survey, and we'll answer them together with the panelists. For everybody watching, you can find the link to the survey in the chat that will be posted in the chat, and you can find the link to the survey there, and you can, please do fill it in while we're talking and along with us. That's absolutely fine as well. That'll be lovely. Or you can fill in the survey afterwards. But it's really important that we can have as much input and feedback via this survey as possible. This is a rare opportunity and an important opportunity to give our feedback. So feel free to follow the link, take the survey with us, or complete the survey after the webinar in your own time. And as an added incentive, there is a prize. Everyone who completes the survey will be entered into a prize draw for a hotel night and dinner for two at the Blue Orchids Hotel, which is fantastic. It's a lovely sort of bit of icing on the cake there. Okay. Throughout this webinar, the questions will come up on the screen. Together we'll answer them as a panel, sharing our stories and experiences and discussing potential ways London councils can be better prepared to suit our needs. Yes, I did read most of that, as you probably gathered, but you know what? I hope that gives everybody an idea of what we're trying to do here and the importance of this event. We have, to do this, a fantastic panel of mental health experts, community experts. I hate to say words like community leaders because I don't believe in that. But some lovely creative people as well amongst us. So what I would like to do is I would like to hand over to the panel. And what I'm going to ask you to do is to say your name, your profession, and the pronouns that you would like us to use. But I shall start with myself first, and then I'll pick somebody. So as I said, I'm Joshua of the Gained Network. GIN are an LGBTQ. We provide a social, friendly, fun space to help South Asian people connect in a friendly space, get to know each other, have fun, and build up their support networks. Dare I say, surrogate families. Well, I've said it now. Okay, so that's Jin. I'm also the founder of a company called Evolve 5IR, which is a technology thought leader company. But that's about me. I'm going to hand you over to the lovely panelists, and I'm going to go in alphabetical order. So panelists, be prepared. You are going to have to say your name, your profession, and your pronouns. What you do, a little bit about yourself. So the first one is Lokesh. Lokesh, Saini. Go on, Lokesh.
Hi,
Lovely
everyone.
to have you here.
So my name is Lokesh. I'm a designer and developer based in Southeast London. And I'm also currently studying at University of Arts London. I moved to London about 2 years ago. And my pronouns are he, him, or they, them.
Thank you very much, Lokesh. Next, Mira Kapadia.
Hi.
Lovely to have you here.
Thank you, Joshi. It's great to be here. So I'm Mira Kapadia, and I'm a psychotherapist, an adult and CAMS psychotherapist, and CAMS is Child and Adolescent Mental Health Services in the NHS. And most recently, I've been a Darcy Fellow. So thank you very much. And my pronouns are she, her.
Thank you very much, Mira. That's great. I'm going to Dr. Bhavan Joshi. And Bhavan Joshi is another Joshi like me, although we both look very gorgeous and wonderful, and he has a lovely smile as well. We're not actually related at all. He's a dear friend of mine, Dr. Bhavan Joshi.
Hello, everyone, and it's great to be here. I'm Pavan. I am a medical professional from background, so I'm a doctor, and I have specialist training in mental health, so I'm a consultant psychiatrist. And I work with the Community Mental Health Service. My role is actually assessing the patients who are referred from primary care, GPs, to mental health services, which includes assessments, diagnosis to suggest the right pathways, and help them throughout the journey in the secondary mental health services until they're ready to be discharged back to primary care. Areas of my interest, one is physical health and mental health integration. So, for example, how depression affects diabetes or vice versa. The other area of my interest is LGBT mental health. And the third thing, which I'm very passionate about, is the integration of culture and mental health. So that's me. My pronouns are he, him, they, them.
That's great. Thank you very much, Bhavan. Sana, lovely to see you again. Oh, I'm so glad you're here.
Hi, thank you so much for having me. So my name's Sana. I'm a queer Pakistani Muslim woman. I am just about to qualify, literally a week away, as a psychologist. I identify as a liberation and community psychologist. And yeah, I've just been working in homelessness for the last year. My research and areas of interest are very much in deconstructing whiteness within the profession of clinical psychology. And yeah, my research is just about to be published on that, so I'm looking forward to sharing that with the world. And I'm also, I do some things in media, so I presented last year a documentary on mental health for Channel 4, and I am a poet and working on my collection to hopefully come out next year. So that's me. I'm also, so I just want to say, I'm also have had a lot of my own lived experiences of using mental health services and using CAMS as a young person. So I have been on like both sides of the system. Yeah.
Oh, that's great. Thank you very much, Sana. That's wonderful. I can see a quick note in the chat room saying sound may be a bit low. All the panelists, can you hear me clearly? Yes? Good. We may have to speak up a bit or move closer to the microphones, okay? Thank you very much, everyone. I'm so glad you're here. So yes, look, we're all in a good mood, we're all happy, but as I said before, this is a serious subject. You know, there is anxiety. I mean, if I dwell on it, if I go back, I can sort of still feel it here. There is anxiety. So here is a wonderful opportunity to talk about our experiences as queer people, queer South Asian people, to talk about the impact and experience with COVID-19 and lockdown. Okay, I'm going to go through 10 questions. I shall start again. I'm quite happy to go in alphabetical order again as well. So the first question is going to be, the question should come up. Yes, thank you. Thank you, Alex. Lovely, perfect. Hopefully everybody watching this can see this. So the first question is, what has helped or made it more difficult to cope with the pandemic and social distancing measure, including lockdown? Should we start with Lokesh first? Lokesh, hi.
Okay, I think I'm going to be the one who'll be starting every time, I guess. So,
around a bit, you never know. If anybody's feeling too comfortable. Go on.
Yeah. So with social distancing and the whole lockdown, I think me being quite new here, it was a very different experience than people who already live here for a long time. Because I moved here like almost like 2 years ago. Like most of my support network was back in India. And when I moved here, I didn't have a lot of support network. So the first thing was making friends and having a support network around me here. That's what I did. But also, most of the support network that I had was students and people who were immigrants as well. And during lockdown, they went to their own countries or their own cities. So, like, I think not having that support network just next to you was the hard part. And what made it easier would be, I think, the availability of internet and the ease that it has given to be able to connect with anyone throughout the world. And yeah, I think that definitely did help to connect with others, but I think the personal touch where you physically meet someone and you interact with someone, that was lost.
Absolutely. And you know, that's a very important point, being a student from India and in England at the current time. Being disconnected from your family, having that anxiety about what they're going through. Thank you very much for sharing that with us, Lokesh. Should we, I think Mira, are you okay to answer the same question?
Yeah. So first of all, as a psychotherapist, I'd be looking at the fact that we all feel more anxious. You know, our normal ways of doing things have been taken away from us. So maybe we escape people or things or places we don't want to be in by going out and being busy. We can't do that. We can't have the normal routines and boundaries. You know, research has shown that we're all nationally struggling with sleeping. So I think some of the things that have helped me and hopefully other people is, as a GYN member and organizer, I've been involved in really seeing how our WhatsApp group, there were two sorts of people and reactions. One was, you know, I want to know everything I can about coronavirus, help me do that. And, you know, for some people that's really helpful. And for others, it's like, really, I want to put that at the back of my mind and I want to just carry on functioning. So what I suggested very early on is we created a separate WhatsApp group for the coronavirus. So we could help contain the anxieties while not infect everybody with them. And obviously the normal things I'd suggest is not watching news 24/7 because that will increase anybody's anxiety. The other thing is, as GYN, we started doing a lot of online events, and I started this pranayam group. And it still exists to today. So if anyone wants to join, feel free. So we meet every morning at 8 o'clock, and Joshi's been part of it. So that's been fantastic. And we meet 8 o'clock every morning, and we go back to the Indian heritage, which is breathing techniques, forming a community, meeting every day. The 8 o'clock routine, some people were really stretched with it, but actually it means we do what we would have normally done. Get up at a normal time, have our pranayam, have breakfast and start work at 9. So I think those things have really helped. And with the pranayam group, I think what also helped is we started sharing the stories of people we knew who had had coronavirus, people who had died through it sadly, people who had other illnesses. We lit a candle. We did some kind of rituals that helped after 7 days of people who have passed away to have the normal rituals that are missing in society because we can't meet the sick, we can't go and visit the bereaved. So those things have been really helpful, I think.
Thank you. Absolutely. Thank you, Mira. And certainly I remember the anxiety in those early days. You know, we have a WhatsApp group which had about 90 members. Within 2 days of the virus and all the information coming from the media, about 20 people left the WhatsApp group. There was so much anxiety being shared on the WhatsApp group. And Mira's absolutely wonderful, setting up those daily morning meditations, which were like crack the whip. People are going to come via Zoom onto these meditations. Paul Riders just mentioned Zoom has made it easier to reach out to the LGBT community. Oh my God, I never knew how to use Zoom before, you know, this. I didn't. And suddenly I was meeting people more on Zoom than actually I'd done physically before, especially in those early days of lockdown, but the anxiety went straight up. So absolutely. Thank you for that, Noel. Great, wonderful.
Sorry, can I just say one more thing? Sorry. So I think what hasn't helped is things like social distancing. The language is actually a misnomer, because we're actually more socially connected. I've never socialized with people pre-breakfast, right? But I do every day now. So social distancing is not the right word. We're connecting much more, but it's physical distancing. And I think the other word of COVID secure. I mean, we're not in army trucks. I think often we put to the back of our minds the fragility of life. So we're not COVID secure, but we're all taking more responsibility for our own and other people's health than we have ever done.
Absolutely, absolutely. Some absolute good points. I'm going to keep my eye on the chat room as well, because, you know, to see if I can see another comments from Paul saying, you know, they would love to connect to Jane, but also in Wolverhampton, LGBT community has been struggling with mental health during lockdown, even more than ever before. So this is not a London phenomenon; it's all over. Thank you. Dr. Bhavan Joshi, Bhavan, would you like to go next? It's the same question. Do you want me to repeat the question?
No, I know the question. Thank you. Thanks, Joshi. I think very similar to what Lokesh and Mira have said. I think some of the key things which help me is to stay connected with people around, and noticing where my real support is, and also being mindful where the anxiety is coming from, and actually bring more of the real connection and reduce the anxiety was a key part of this, like Mira was saying and Lokesh was suggesting as well. So that was quite helpful to work out very quickly where I need to actually put more emphasis on and where I reduce my emphasis on. So I have been a member of few groups. There's a group called Loving Men, which is really good support network. And I noticed that group was very helpful, supporting and holding group, where they managed kind of the anxiety coming from social media news channels very well, whether they continued with their humor and support and access. That was really helpful. While I was noticing that there are other groups where people were sharing lots of anxiety stuff, which was only escalating. And that was quite helpful to work this out. The other thing was helpful to be with my partner around this time, and we moved in together for this time period. And it was quite a useful experience to be together, but I think we shared this kind of stress together. So somebody being close to was quite helpful. And so when the anxiety actually increased for either of us, we were there for each other. And I think that was quite helpful. Having a structure was helpful. So I work in the NHS, and NHS was going inside of what was happening in public, everybody aware of NHS. Suddenly NHS was in the center of attention, which means the NHS professionals were experiencing a different kind of anxiety. So I had amount of information passed around all the time in my emails and work emails as well. And noticing again that we are in together and we need to find a way to help ourselves and help the community, provided a kind of some sort of shared purpose. But also because of the NHS job, I had a structure. So I would go to work twice a week. That was quite helpful. And that I had a structure, that I was not always at home. And I think I was lucky in that sense. So, but the message was there that having some sort of routine, whatever it was helpful. I did also actually become part of some of the communities with Jin, of course, and ran some workshops with Nida and Joshi as well. Group called Sathi, for people to get together and talk about how these experiences helping, and picked up from the themes as they came from. So we talked about racial equality and us and how it has affected, because COVID has brought the health disparity among especially ethnic minorities and other minorities as well. So having that connection was quite helpful. And having routines actually within the personal life as well, that having some sort of exercise, yoga, and where I could go for a walk, that was quite helpful as well. What wasn't helpful, as I already mentioned, that actually being aware of that when the anxiety was passed around, and there was in the beginning, actually, I'm aware that I was really anxiously watching the news, and that was only increasing the anxiety. So that wasn't helpful for over excessively relying on the news, which was quite actually intense at the time. Obviously, like Mira said, the physical distancing was challenging. Noticing that I can't reach out to my friends and family physically, especially family in India, was quite an anxiety, and that was a challenge as well. So yeah, there was a kind of some really good support network, and then there were some of the challenges, of course, which were not that helpful.
Thank you very much, Bhavan, for that. And again, it's a key worker working in the NHS. You know, the people we are clapping for every Thursday. Remember all that? You know, it's you had a degree of anxiety, which again, as people have spoken to me about in the interviews I've done, you know, leading to this, people who have been key workers, how hard it was then often to go into work and be really quite anxious and stressed themselves. Yeah, lots of courage and bravery. Right, thank you. So I'm going to move on to Sana now. Sana, hello.
Hi.
Same question. Would you like me to repeat the question?
No, it's okay. It's all right. I've got it. I think I'll start off with what was difficult. So it was my first Ramadan away from home, and I've experienced a lot of like rupture and grief with being cut off from my family because of my sexuality. So it was my first time defining my own Ramadan, and doing that with my partner in lockdown, when also it was very hard to access, as you all know, like community contact and do iftars together. And, you know, I think like that was really, really difficult. But also I think incredibly transformative. And I think there was something really and I think this doesn't just apply to Ramadan, but I think what the pandemic has forced us to do is to confront ourselves and be with a lot of the feelings that we're often avoiding through capitalist, like really fast-paced routines, you know, and working constantly all the time. And I think like actually having to confront some of that mourning and that grief and be with my own difficult feelings was really, really important. But yeah, I think finding connection both with having my partner to do that with, but also online spaces were really significant. But I think just generally more broadly, what I found helpful in managing this whole period is self-connection. I think a lot of people have spoken to connecting through others, and I do think that's been really important. But I think just coming back to myself through prayer, you know, through meditation, and being privileged enough to be able to work from home, to have a bit more space and stillness to do some of those things. I think a lot of us are being able to actually be with our feelings a bit more, which is one of the upsides, I think, of this really, really strange time, because we're having to do the work, the emotional work, you know. So that's probably it for me.
Thank you. No, absolutely interesting. You know, I think as South Asian, sometimes in difficulties, we do connect more via meditation and by going inside. And I'm going to put that out there. I think as a South Asian community, whether it's prayer or meditation or reflection, it does impact us. It does make us feel better. It does allow us to connect with ourselves. And you know, like we mentioned earlier, Mira hosted these daily morning breathing technique pranayama meditations at 8 in the morning. It wasn't like too late either. It was 8 in the morning to give everybody some grounding and say, you know what, we can be a little bit connected. It helped to connect. We can go inside. We can't really control the virus much, but at least we can control a little bit about our feelings. So yes, I resonate with that. Thank you, Susanna.
I think as well, I think the connection with others is only going to be meaningful and truly fully present if it's coming from a resourced place. And I think connecting with ourselves means that we can give ourselves much more fully to others. So I think that's part of it as well.
Yes, absolutely. No, that's great. Both Bhavan and Lokesh mentioned having families in India. I know Lokesh's parents live in India and you haven't seen them since the beginning of lockdown, you know. and I think for yourself the same, Bhavan, as well. You haven't been able to see your parents again. That has its own anxieties, and staying connected, and how does one stay connected with that? Okay, I'm going to move on to the second question, although I'm sure we could talk about this particular issue for quite a lot. Number two. Thank you, Alice. Did you feel supported by those around you? How did this help? I'm going to be cheeky. I'm going to go sort of backwards. So, may I ask Sana to answer first this time? Is that okay?
Sure.
Sana?
Yeah. Sure. No, yeah. I mean, I think that was really, really important. I just touched on that a bit. I think that I do think that finding resources for myself independently was really, really important as a starting point to be able to really engage meaningfully in connection with others. But I do think especially going through Ramadan with my partner and having physical contact, having someone to really process things through with was really, really significant. I think therapy has been really key for me, and that shift from face-to-face therapy to online therapy has been a big shift that takes a lot of adapting to. But in some ways, I think, and I don't think this is not a generalization, but for me, allowed me to move into and talk about some things that I haven't been able to in the physical face-to-face space. So actually I think it's been a really beautiful and different journey, but I think therapy has been really, really important, and I have felt very supported by my chosen family. So I think going through the grief of a lot of disconnection from my relatives and the people I've grown up with, it's really being able to actually redefine what family is and have people show up for me repeatedly, through the barriers of not being able to actually spend time with each other physically has been really, really important. So yeah, it's been really helpful.
Thank you very, very much for this, Anna. The next person in by alphabetical going backwards is actually Bhavan. Bhavan, the same question. Did you feel supported by those around you? And how did that help?
Yes, Joshi, I think I did find lots of people around me very, very supportive. And partly it was because we were all in this together. It was something happening outside most of people's control, and this feeling of togetherness started to kick in because it was external, and we know from research and evidence, if it is a feeling of togetherness outside external, people start to bring the kind of support for each other as well. So I found actually lots of my friends, in fact, even those friends who I hadn't spoken for a while, reached out and asked me if I wanted to have a chat and stuff as well. And it was a bit of both. They wanted to reach out for me as well as for themselves as well. So that was quite good, actually, that some of the connections which I didn't have, they actually re-emerged. But the people who were around me, like my partner, who was really around, and we constantly bounce back our anxieties as well as our fears and what could be working and not working, that was quite helpful. But I also was working throughout this pandemic, and NHS work was quite busy as well. So I did get support from work, and that's something to be mindful as well for me, that that again, as the anxiety was increasing in NHS, people got together and figured out how best we can keep things going rather than come to standstill. We need to continue to work this together. And I think people from different services started to ask whether can we help and can we join in as well. And I remember lots of people started to volunteer to work for NHS as well and say, well, can I do something? And I work in mental health services. Some of my patients are severely unwell. They are at homes. And there was this anxiety, how could I reach out to them? And people who stepped up were a huge support, because we can provide the medications, we can provide the right support in time. So that was quite helpful as well. Again, the friends and family, although we couldn't meet regularly, but I think the technology was actually allowing us to connect with friends and family, and they kept in touch. And we know that the pace of the pandemic was different here to India, for example. So while in India, when we were actually going through lockdown, things were slower there. So reaching out to them and getting a different experience, a different kind of feel, because they were not feeling as anxious, was quite helpful as well. And now they are experiencing the kind of increasing number of cases. But we have had this journey, and I can share some of my experiences as well. So that was the kind of experience we had, and I had with my work colleagues, my family, and my partner as well.
Thank you, Pavan. Absolutely, and that's quite interesting because, again, the anxieties about your families who are living in the subcontinent as well. You know, yes, India's in a very difficult situation at the moment. I remember the anxieties, of course, we all had here. And my father was actually in India, and he was trapped there because the flights were cancelled, and we had to put him on a plane, one of the chartered flights the government set up, and somebody had to pick him up in Ahmedabad at his house in lockdown and make sure he had the masks. And I was very, very anxious. I picked him up at Heathrow Airport. I'd never seen Heathrow Airport so empty as I did at that time. You know, and he's 84, bringing him back here. Yes. Okay. So I'm going to move on to Mira. You're next.
Hi. So I guess I would say I felt supported. Luckily, I have a wife and we live in a nice, lovely home. So that was really important that me and my wife were together, because I know a lot of people actually live on their own, and then that whole sense of who do you connect with, who do you kind of hug, who do you cry with, or any other emotions that are going through you, you know, there's no one to share it with. So I think having my wife really helped, and also having the community, you know, the Asian LGBT community really helped. And another thing that helped was actually being there to help others. So my wife is part of COVID mutual aid group locally, and through my Darzi fellowship, I found out that there was 120 spare meals going. She found the COVID mutual aid, and we were delivering food parcels. I cared for my father, looking after him while he was shielding. So having meaning and purpose was really helpful, connecting with other people and sharing that sense of meaning and purpose. Unfortunately, I think with the anxieties that people are facing, they often leak out in destructive ways as well as constructive ways. So unfortunately, we've been facing ongoing LGBT hate crime. And I think Stonewall has said that there's an increase in LGBT hate crime during COVID. And I've heard there's a lot of increase in racism. So I've had people come and help me. So my lovely pranayam group, Joshi's come and stayed over. You know, some of the gym members who I didn't even connect with before, like Praveen, came and said, let me help out. I had people, friends of friends, who knew lawyers that, like Saima said, oh, let me connect you with this lawyer, Helen. Someone else said, let me connect you with this lawyer, Alex. So a friend of mine said, we've got an empty flat, you know, in Kent, go and live there, escape. So, you know, really seeing that love is the antidote to hate was very helpful, and that community and moral support and empathy kind of helps the isolation, because we can't control our circumstances. People will leak things out in many different ways. What we can do is connect with the love and the sense of community and the people that are there for each other, because I think a lot of us have grown through the COVID experience too, and done things that we would never otherwise do, or always had it at the bottom of our to-do list, but we did them. Like, we got folding bikes, I got a budgie. So there's things that, you know, having a pet can be really helpful. So there's lots of things that can help feeling supported in your homes and with your communities.
Yes, absolutely. No, thank you very much there for Mira. You know, when I reflect back on the journey we've all been through in this, you know, I'm just so amazed by some of the resilience and courage I saw from friends and neighbours, and the LGBT community helping each other as well. No, thank you. I just want to remind the audience that Please do feel free to share your experiences on the chat room. That'd be wonderful, because we are trying to pick up as much information from everybody as possible to share. So share your experiences in the chat room, and also, of course, feel free to ask questions in the chat room. You'll see my eyes going like this all the time. That's the other problem with Zoom. I'm like, very conscious of my eyes going like this and my hands going like this. But I do that because I'm reading things in the chat room. Thank you, Lokesh. Would you like to go next?
Yeah, sure.
Did you feel supported by those around you?
Yeah, so I think with direct physical connection, I think I had moved to a new flat in January. So I was able to connect and socialize with my flatmates, and we got to connect really well. We got to share a lot of things, which was a really good experience. And other than that, I was able to connect with my friends throughout India and in London. Also, it also helped me, like during the lockdown, there were like different groups that wanted different things from this whole social thing. Some people wanted just the social interaction where they could have a chat and just socialize in general. And also there was like people who wanted to share things, people who wanted to reach out for help. So I was able to connect with all sort of different groups and be able to help them and be able to be part of them. And also, like, I was able to connect with a lot of people. For example, I didn't have a very good relationship with my brother, and during COVID, I was able to like connect with him a lot more. So we would talk almost every other day, and those kind of things did like did help me and help me like improve my relationships with other people. So I did feel supported. Yes. Yeah.
Oh, excellent. Thanks very much, Lokesh. I've just seen an interesting question here. Well, actually, it's a question and statement in the chat room from Manish. Living in developed nations such as the United Kingdom is a blessing for help for us. What can we do for people who are in need, who are living in India? It's a hard question. Would anybody, I think just one person, would anybody like to answer that question?
I'll give it a go.
Thank you, Mira.
I think that, whether it's India or anywhere in the world, some of our gin groups and other groups that I've started, people are joining from, Tenerife and Australia and India. I think, Zoom actually allows us, or not just Zoom, but any of the software technology really allows us to connect with people who are really isolated. And I think, where people might not feel safe to come out in India, Pakistan, Bangladesh, or any other country, we can maybe advertise more there so that people can feel that there's a safe and confidential space to come out, and they can get some kind of befriending. So at the moment, we're starting up a group that will do some befriending, for the Asian LGBTQ community. So I think there's a lot of help out there. It might not be on your doorstep, but that might be a blessing in some ways if you're worried about coming out publicly.
Sure, absolutely. No, thank you.
I'd like to add some to that.
Absolutely.
Like from my personal experience, I think specific to like my experience in India, like a lot of people don't really value the mental well-being and like anxiety. Then they don't really think about anxiety. And a lot of friends of mine back in India were going through the anxiety, but they were not comfortable with the idea of accepting that. So like what I shared with them was to be able, like, that they should be comfortable with it, that it is a natural thing to go through. Whereas like there's not a lot of awareness there, but we have a lot of awareness here. So I think that really did help, particularly in case of my friends.
Excellent. Thank you very much, Lokesh. That's great. And I really want to point out the fantastic work the South Asian LGBTQ support groups have done. Whether it's Hidayat, Sarbat, Iman, Nat and Maz, Jin's been mentioned, Gaysians. It was really lovely how the community connected with each other to hold Zoom sessions. Maybe 10 years ago that would have been much harder, but I was really impressed by how much the LGBTQ community was picked this up and actually started helping each other on it. And I think we need a lot more of that. And hopefully we'll come up to that later. Right, in true Desi fashion, we are running late, to let you all know. Yes, we're running late. So I've got to speed things up. We've still got a few questions to go. So number 3, and I think we'll try and confine about a minute per answer if possible. Okay, so number 3, thank you, Alex. How can the experiences of marginalized groups be fed into health, mental health, and social services to be better prepared to support them in future? I think Sana, would you like to start first? Is that okay?
Sure. Yeah, I think inherent in that question is like the assumption that there's a dichotomy between like the people in services and the people that are using them. And I think like actually what we need to be doing is working back to strip this illusion of like patients and professionals as much as we possibly can. And I think there's lots of intersections to that. And the reality of it is that our services are very, very much dominated by white bodies, and I think, I mean, I can speak to clinical psychology. I haven't got the stats on psychotherapy, Mira, so you can maybe drop something in on that. But, clinical psychology at the moment is 88% white. That's the current demographics, and white female as well. And most of the service users in London are people of colour. And actually what we've got, that disparity means that, of course, we're not visible. We're not seeing ourselves in the services that we're seeking help from. For me, even as a young person, and I was trying to access services, I was repeatedly moving through seeing white women that I'd have to really, really draw on the effort to explain my identity to before I could even get to the grief, before I could even get to what the suffering was. So, I mean, I think the specific question is, what can we do about this? How can we bring voices in? I think there's a lot of layers to it. I think it isn't just about diversifying the profession and the different professions. I think, yes, we do need to bring in more diversity. We do need to bring in more people of colour. We do need to bring in more Desi people. But I think that isn't going to do anything to create structural change. The knowledge, the curriculum, education systems that make psychologists or psychotherapists are rooted in white authors, white knowledge, and I think actually, again, reinforcing the idea of the only place we can seek help is in these medicalized systems is problematic. And I think what we need to be doing is redistributing money into community-led organizations where we can create spaces that we can talk more about our suffering, not send people with a diagnosis to a system because you're ill and there's something wrong with you. Actually, how can we get better as communities to say, I am suffering, this is the way that I'm suffering, how can I look after you and you look after me better? And we need resources and money to do that, and that needs to come from the commissioners that are often white people. So that's probably my answer. Sorry, there's probably quite a lot in there, but
no, absolutely brilliant. And so many things were spot on. Thank you. Absolutely needs to be said. We do support our communities as best as we can, but we're all struggling. It's all struggling. I'm not going to mention the F word, and I mean funding. That's the F word. It's hard and it's a struggle. And I sometimes say to people, well, if we don't, who will? And this is why surveys like this, and big thank you to Brixton Reel and Thrive LDN. This is why surveys like this hopefully start getting the information together to make that impact. So thank you, Sana. That's great. Bhavan, Dr. Bhavan Joshi. Thank you.
Thanks, Meg. So I think I will agree with what Sana is actually saying here, that we probably need to bring a bigger change within the society if we want to actually move forward. And one of the things come from South Asian community to my mind, which Lokesh probably was alluding to before as well, that we don't acknowledge mental health difficulties within the community as much as we should be. In fact, we didn't have a proper word for some of the difficulties. I mean, when we talk about depression, we talk about psychosis, we don't have really language in South Asian communities as well. And if they are very stigmatized. Pagal, Bimar, all sorts of kind of stigma attached to it. We need to actually develop a language first. I think we are if we need to address what mental health difficulties are, we need to actually help our communities to express ourselves, our feelings, emotions. Once we have the language, then we can communicate. Then we can start working on research, bringing the kind of evidence together, how we actually cater towards what is required. So we know from evidence point of view, the South Asian community do not access mental health in comparison to white community in time. We also know when they do, they actually often disengage quickly with the mental health services as well. So what we need is more research for sure. We are actually lacking the research. What we are noticing is that either there is a research very much focused, like Sana was alluding to, because there's a white community carrying out research about the mostly white population, because they are participating more in the research. The patient group is represented by them. We're getting the data about what is happening with the white community as such, less for the specific South Asian community. If we look at the South Asian community research, we find research as mostly directed to Pakistan, Bangladesh, Sri Lanka probably. But what we are not getting is how the integrating population finding, the South Asian community in the UK, for example, here, what are their experiences and how they are actually dealing with the mental health problems or accessing support and so on. So what, like you said, Joshi, spaces are very valuable. But I hope these spaces are not only tick box exercises to feed into, that actually for leaders to say, we have ticked the boxes to find out what is happening with the ethnic minority in the COVID-19, because everybody knows from the media, BME doctors are dying more than white doctors. BME people are actually more at risk of getting infected and dying from it. So there is an urge from leaders to do something, but I hope it's not a tick box exercise. There is actually more incentives to do more research within the community. Unless we understand what is the language of the community, how it is expressed, and what are the kind of systems which work, we will lack. So we need to continue to do more of these efforts.
Absolutely fantastic. Thank you, Pavan. I feel like saying quite a lot, but I'm going to control myself. So many thought-provoking comments.
I'll try to narrow down my answers.
Yeah, no, but it's fantastic, and I'm so glad, both yourself and Sana have shared those points, very important points. Mira, hello.
So, Sana, I can't give you the statistics, but I qualified as a psychotherapist 20 years ago, and I was the only one in the whole institute that was Asian. And I still hear the same dilemmas of trainees, that it's very Eurocentric, it's not catered to the minorities, you get a half-day training if you're lucky, and LGBT issues half-day, and God forbid you're intersectional and have both, that's not in the curriculum, sorry. And I think as far as Pawan was saying about the statistics, I mean, I don't know how many people realize that the Asian women's suicide rate is 3 times national average. And that's very well hidden by the fact that when you look at suicide rates, you think of white men, in their 30s or 40s, middle-aged white men who are single. But actually, there's no ethnic breakdown. And if you look at the ethnic breakdown, it's Asian women. The self-harm rates of Asian women are, at least as high, if not higher than white women. The problem drinking in the Asian Punjabi male community is very high. So we really need ethnic breakdowns. But in terms of solutions, to think about how we really tailor our services, mental and physical health and social services to communities. As a Darzi Fellow, I've actually just finished a project where I designed and delivered a service, a project that was co-production. And co-production is where you design and deliver services with the community. So you ask the community what matters to you, and they'll tell you. And those are the service improvements that we can go about. And even better than that, the community will tell you what they're willing to volunteer for. So loads of people wanted to volunteer to help that local GP practice that I was working in. So I'd be really happy to spread more of these kind of co-production ideas where you knock on the right doors to get the right answers. And NHS England, through the Experience of Care team, is saying we want to do this nationally. We've got a film coming out. The CCG and Well CCG is willing to take this forward. So I hope more and more services are co-produced with the community, so that we get the assets of the community and we get away from this deficit model of provider and customer. And I think, just to leave you with a quote that I learned on my Darzi Fellowship, is in any other industry, such little regard for your customer would lead to bankruptcy. But in health and social care, it's business as usual. So we really need to change that paternalistic attitude to the communities we serve.
And absolutely, and thank you for that, Mira. You know, that's a shocking statistics. I didn't know that so many Asian women were committing suicide. The media doesn't talk about it. I like to think of myself as somebody who's a little bit more aware, but I didn't know that. So, you know, thank you for raising that. And also, we need more conversations and openness around this as well. Thank you. Lokesh, would you like to go next?
Yeah. So I think like most of the things everyone said, I would be just reflecting on that. But like what Mira said, and also like along with that, there are like so many other researches that come out like every now and then that there are certain minority communities that are in fact most affected by HIV crisis or affected by mental health crisis or even now COVID. But there's nothing really potentially being done to fix these problems. There's always these data that are always out there, and there are like new researchers coming up, but like we never see something that is being done to that usually. Yeah. Also, I think with yeah, I think that's yeah, that'll be it.
Sure. No, so thank you, Lokesh. I know we're pressed for time, but I'm going to mention a comment, Mira, you've made about lesbian invisibility. Mira, would you like to? I've noticed you commented about lesbian invisibility. Do you want to say a quick 20 seconds before we move to the next question? Because I think that's important.
Well, I think often when we look at intersectionality, if we're talking about gender issues, it's white women. If we're talking about race issues, it's black men. And this whole thing, and if we're talking about gay issues, it's often men. So it's like, where do the lesbians really fit in? You know, the nice Victorian thing, it doesn't really exist, or we don't need to get sexual health services for lesbian women. You know, so it's really thinking about how we make these issues more visible about the needs of lesbian women and Asian lesbian women.
Thank you. Thank you. No, that's absolutely. Again, you know, in good fashion, I'm going to gently remind everybody we've got 1 minute per answer because it's a fantastic discussion, but we are about, oh God, we're quite a way through. So number 4, what changes are needed? Oh, thank you. What changes are needed to make London a more inclusive place to live, work and grow? Right, shall we start this time with Lokesh? How do you feel about that, Lokesh?
Sure. So I think like making places more inclusive is like a very a big thing that has already been happening for a long time. That is being worked on for a long time, and also COVID has impacted on it a lot, but it hasn't completely changed it. These inequalities already existed, and COVID has actually exaggerated it. So I think the most important thing is the awareness of it, and awareness of it among the government and the people who are in power and who are making the policies and laws for that. And yeah, also I would say a representation of certain communities who are mostly affected by these kind of things would definitely make a lot of difference.
Thank you. Thank you for that, Lokesh. I'm going to move on to Mira. Mira next, yeah? So we're sort of going backwards in alphabetical order now.
Yeah, thanks. So I think what COVID has really shown is that this centralized one-size-fits-all approach really doesn't work. You know, the national lockdown was really, well, anyway, I won't say what it was, but anyway, it highlights the infrastructure that's a centralized infrastructure where the people at the top know everything, and then they They do a blanket approach to everything. And what's been shown is you need much more granular data. So local lockdowns, looking at the needs of local populations. And I think the way forward is to have a more local context, ask your local community, whether that's BME people, LGBT people, disabled people, ask each of them and get, their buy-in to finding the solutions, not just identifying the problems, but finding the solutions. Look at, we had 750,000 volunteers for the NHS in 2 days. So here we are, NHS struggling. No service can fix the problems we have with COVID. We all have to take part in it. So a sense of social responsibility where the providers and consumers of services relate in an adult to adult way. And we start to shape services according to what people need and stop doing the one-size-fits-all command and control approach. That's my idea.
Fantastic. No, that's absolutely great. Thank you, Mira. Pavan, what changes are needed to make London a more inclusive place?
Thanks, Joshi. I think I'll keep it brief because Mira and Lokesh have covered some of the key things as well. For me, London is diverse and multicultural, but London has failed the test of integration of different cultures. And what we still know in London, there are people living in pockets, i.e. silos. Previously there were ghettos, but what's not happening in the community is real integration. And we know when people segregate, they suffer. There's a kind of disparity between the mental health, access to mental health services or health services, and as a result, kind of increased number of mental health or physical health problems for people who are marginalized or not integrated. What London really needs to do is to bring people together, not just kind of shape of it's a number of different cultures living here, but how they are living, how much integrated they are. That's the task for London. We need to bring people together and create a unique kind of and like Mira said, essentially, like people communicating with each other, learning from each other, and feeling part of the joint society rather than being separate from each other.
Absolutely. No, thank you very much for that, Pavan. That's great. Sana, same question. What changes are needed to make London a more inclusive place?
I thought this question was a bit massive, so I'm going to come in with a very niche response that's quite personal to me. I think that it's amazing that we're having an increase in more inclusive spaces for queer people of colour, and there's more and more queer DSC spaces that are that are amazing. I think an issue that isn't spoken to enough is how much trauma there is in those spaces and how much that gets carried out and perpetuated, and actually how we can negotiate safety within those spaces without repeating experiences of exile and marginalization that we all have, and basically repeating that towards each other. I think especially in the space, recently under COVID and this anxiety, I think with that stress, we're quicker to fall to black and white thinking, which is all bad and all good. And people are therefore, in an increased culture of call out culture, really, really unhelpful and very harmful behaviors are being weaponized much more quickly. And actually in communities where we have young people of color who are incredibly traumatized themselves, and that behavior is then used and weaponized to them too, within these spaces that are supposed to be safe, how do we manage that? It's a really, really difficult thing to do, because it's like, I'm not suggesting there's a regulatory body for like queer spaces of color, but I think that we need to be, more educated to how we can manage issues like accountability, harm, looking after each other, and create therapeutic and safe spaces. These are the things that I think we need to do more of, and we're not having enough conversations about. And I think, sorry, one other thing is the intergenerational experience of elders who have managed that, and have more experience of that. We need to bring their wisdom and their experience into younger spaces. That connection needs to happen more to help us learn how to manage these situations as well. I think there's a lot in that that I think could happen too. So yeah, that's some of my thoughts.
Yes, absolutely interesting. And again, this very sort of simplistic black and white or almost plain narrative which the media propagates as well. The media loves that. It's simplistic and it doesn't. And I think the other thing you mentioned, Sana, about bringing our elders into this. We all know, as South Asian LGBT people, we have the vast majority have issues with our parents or our communities. And I think not only do we need to take them on this journey with us, we need to understand their journeys, but then it's not just the parents, it's the community and the temples and the mosques and the gurdwaras as well. And I think really to make London more inclusive, we also need to think about how much our communities also make us feel inclusive. Family, community, places of worship. I think that's a conversation that at some point also needs to be had. Thank you very much for that, everyone. And number 5, okay. So number 5.
I don't think, I'll just say a quick word about that, because I don't think I've answered that one. But I think really having tailored support, seeing diversity as the solution, not the problem, is really important in telling the stories, so that we have a person-centered approach to, you know, the stories that inform policies and procedures. Say, you know, that we see them as events that actually highlight larger patterns in society, and that qualitative is as important as quantitative data in having, you know, creating policies, really.
Yes, absolutely. Did I forget to ask you then? So I do apologize. I do apologize. Sorry. No, thank you, because of course watching is only to make London. I do apologize. So the next one, Mary, you can start first, okay?
Oh,
that's for being sorry.
Oh, don't worry about it, Josh.
But number 5, what do we not have in place to listen to the stories and experiences of all Londoners, which would help develop support around your needs?
Joshi, my fault. I just answered that question, so sorry.
Oh, okay.
That was my answer. Done.
You see, no, but both 4 and 5 are similar, as you know, for quite a few of these questions are. So, would you like to add anything else to that, or are you?
Oh, okay. I think again, it's basically tailoring our services to the individuals. So to use a metaphor, often services, if you think about your hand, services are geared towards the commonalities, right? But if you think about what makes your hand special, it's the thumb, it's not the fingers, right? So focus on the finger, focus on the diversity that enables new things to happen. And if you tailor for the needs of the minorities, usually you're tailoring for the needs of the majority.
Oh, thank you. That's wonderful. Good. I'm trying to remember that. That's not an example. That's great. So, right. This can be a random round, so I shall just pick. Who shall I pick next? Bhavan, go on. Do you want to go next? Number 5. What do we not have? What do we not have in place to listen to the stories and experiences of all Londoners?
So when I hear this question, it feels like, again, maybe my skeptical mind says, leaders want to know hastily, once they have identified BMA population are at risk, what can we really do quickly? And I think it is important what Meera is saying, what everybody else is saying, what Sana is saying, that hear to what people are saying, where the gaps are. And I will talk about from health point of view, as I was saying earlier, that we know the South Asian community access health much later, whether it's physical health or mental health. We know from, for example, health point of view, the diabetes is more common in South Asian community, but actually awareness is not that present, and accessing health is not common in the community as well. There are lots of preventative work which could have gone into helping people to not develop diabetes, but that's not there. What we can do is educate South Asian community as quickly as we can that they are actually risk of developing diabetes in this. So what can you do? And these are the health research evidence, such as these are the things can be done for South Asian community as well. Now talk about mental health. We know, which we were discussing earlier, that there is no language sometimes. There's a huge stigma in this society about mental health needs, and that needs to be actually addressed as well. So educate people. Education is one thing. Reach out to people, create kind of networks where there can be healthy debate and discussions within the community, and they can actually learn to see that how much support they can get with regards to their health, which can address lots of kind of core issues. I could say lots of things, but I think I will hold it for now. I'll pause it out. Yeah.
Oh, absolutely, yes. No, and thank you. And if it wasn't for this time pressure, this is a really interesting debate, and a lot of really pertinent, relevant, useful information is coming out. So this is one for Brixton Reel. Maybe we can have a continuation discussion at some other phase 2 for this. Okay, Carrie, I hope you hear that. Maybe one day we'll have a phase 2 for this as well in the near future. Thank you. So Sana, would you like to go next?
Sure. I mean, I think some of what I was saying in the last question, the last response I gave overlaps to this, but I think how we can actually educate, or I don't even know if educate is the right word, but how we can draw on compassion more and more to be able to actually embrace each other's madness, rather than, and use an alternative language than one of diagnosis for our suffering. I think we need to be more and more able to model for each other, saying, I am feeling XYZ, whatever that is, however extreme that may be, however extreme in expression, whether that is feelings of suicide, whether that is hearing voices, how extreme we might understand that to be as in terms of, usually be termed an illness. We need to be saying that more and more to each other so that we can practice being able to hold and be with and be compassionate with that, rather than pushing people away, making them feel more isolated within that, making them feel that they need services, making them feel that there's something wrong with them individually, actually being able to hold them more and more and look to our societies to understanding this behavior. Like, actually, why are you feeling like this? The way that you feel is very justified. Let's think about more why what's going around you is causing that. And I think fundamentally that's through language and conversation and being more compassionate with each other.
Sure, absolutely. Thank you very much for that, Sana. I'm just having a quick glance at the comments and the questions here. I think they will carry on because we are running a bit late. I do apologize for the people who are putting questions and comments in the chat room. It's just because of time. I think I'm going to continue with the questions on the sheet and see how many of them we can clear, okay? And we'll try and get back to some of these questions in the chat room as possible. Okay. So, Lokesh, would you like to go next? Same question.
Sure. Same question, right?
Yes, number 5.
Yeah. So I think what's not in the place is like a lot of times the way these problems are being tackled using the same templates what worked for other communities, specifically white communities, and the same template is being applied to other communities as well, which wouldn't really translate, which wouldn't really work on in certain communities, because, for example, South Asian communities, mental health is not seen the same way as it's seen in certain other communities. So I think personally for me, like having communities like Jin and Sarbat are the ones that have helped people directly with their mental well-being, and I think finding a way to tackle those problems in like a community-based way could also help.
Yes, absolutely. Thank you. Yes, I think the ground level South Asian LGBTQ communities, I've been amazed at how well they've responded to COVID and pandemic. And and actually how well we've connected together as disparate South Asian LGBTQ support groups as well. And I certainly would like to see more of that. I'm going to move on to the next question, which is number 6. Alice, would you like to put number 6 on there? Thank you. What do we not have in place which would help all Londoners develop confidence in social and mental health support services? This time, let's go eeny, meeny, miny. Let's start with Pavan. Dr. Pavan Joshi, you take this one first. Go on.
Thanks, Mike. I think when I want to think about South Asian and South Asian LGBT community, the three things come to my mind, which is very prevalent and important in our society. We need to address somehow these key barriers. One is ijjat, pride. Another one is sharam, shame. And the third thing, ideal versus vulnerability. So there's a lot of emphasis about what is our pride, our family pride. This should be our caste pride, our kind of pride from profession and so on. That doesn't allow people to be humans, people to be vulnerable, people to be able to express their emotions and feelings as well. There's a lot of sharam and shame there. If you don't do this thing, then it's a shame for the family, it's a shame for culture, shame for lots of things as well. This is barrier for people to be vulnerable and say, well, I feel this way. I have these health issues. I'm feeling sad and depressed from not being considered actually pagal, bimar, and so on. We don't allow people to be vulnerable and express themselves clearly as we want, as we would like them to be. So I think there's this huge kind of the emphasis on the ideal version of human beings, and which is away from the reality, is another kind of a barrier for. If we could address these things by somehow bringing people to, again, through education and awareness, that these things could be barrier to not only accessing help, but get better mental health and support as well. Vulnerability is not the weakness. It's the most courageous thing people can do. When people can stand up and say, I do feel sad, you get help. I think this perception of not being able to say where the society's perception is actually, it takes them away from getting help and support as well. So that's what I'm saying is, if we could actually somehow address these kind of barriers we have in our South Asian community about the sharam or what is the pride and so on, then that would be a way forward to address some of these barriers and health inequalities.
Yes, absolutely. Thank you very much, Pavan. Sana, would you like to go next?
Sure. Yeah, I think what Pavan was just saying is really important, and I think, you know, issues around sharam and having more language to speak to those things and is really important. But I think just pulling it back, because I think I'm also mindful, I think there are a lot of issues within our communities, and of course, like, there's so many barriers there, but it's also really important to name that the services are incredibly inaccessible and have a lot more to do to help us feel able to actually have those conversations. And I think there's a lot of stereotyping, you know, there's a lot of stigmatizing and assumptions that are made of DISI people when they come into services. So I think from a service level, there needs to be a lot of change happening. And I've spoken about this already, there needs to be more diversity within services. But I think rather than going into the shifting of the whiteness within services, I think more like, how can we bring the conversation of love into spaces like therapy, because it's all very, very clinical. And I think it's a really weird thing that people just are like, no way, we can't talk about love in that space, it doesn't belong there, that's not professional. But how, at the end of the day, if we're asking for people, like Pavan said, like vulnerability is so important, and vulnerability is what allows connection, what does vulnerability need to be met with? It needs to be met with love. And actually, how can we talk more about what love in action looks like, both in our day-to-day lives, in our intimate relationships, but also in those professional spaces? What is a loving therapist, and what is a love? What does that look like when you go to try and experience love in the therapy room? I think these are the conversations that we need to think about having.
Yes, absolutely. And I think the comment you made about the sort of the generalization of services sometimes that we get, rather than people understanding that, you know, some of the generalizations can be quite negative. I mean, I had cases where people just assume, well, because I was a gay Indian man, you know, I would automatically have problems with this, or this would be okay, and so on. And I think certainly, and it's sometimes almost, oh my God, this is too much of a hot potato for us. Let's just, you know, maybe too much work's going to be required here. And I know, I've spoken to other Indian, not just LGBTQ, but generally the Indian community. A lot of the elderly Indian community have also had the same problems, especially with the NHS, simply because they're old and they're South Asian. It's like, oh, okay, well, let's just tick a few boxes, but without really giving the right pertinent service and getting to know the need of the patient. Yeah, absolutely. Thank you very much for that, Sana. Lokesh, hello. Number 6.
Yeah, so I think with my particular experience has been with support network that I have in my university. I didn't really seek any help outside the university's network, and which is also not specific to the community, but it was like completely inaccessible, where the person who is supposed to be there to talk to students, there are like 2 people 2 days a week for like hundreds of students, and like the services themselves are not accessible at all. And when you actually have access to those services, the person is not really able to relate to you because there are cultural differences, and within university, majority of students being from different countries than UK, the staff is not really trained well for to be equipped to work with students from all different kind of countries where the culture and their experience is completely different. So I think these services for me was completely inaccessible, and was for a lot of other students as well. And again, I relied on my own support network because I just couldn't rely on any of these services.
Absolutely. Thank you for sharing that, Lokesh. Thank you, everybody. I'm just looking at the time, and like I was saying earlier, in true Desi fashion, we're running late. Mira, so you were saying?
I think I haven't answered that question, the last one. That's all right. So what don't we have in place? I think that was the question, which would help Londoners have confidence in mental health services and physical health social services. I think often we don't have enough therapy services in different languages. I for many years worked providing therapy in Gujarati and Hindi. I think that's really important. We don't have enough women's services. I think in the LGBTQ community, most of you know I've got a mission to try to set up something, a LGBT helpline or befriending service, something for the younger LGBT people who are in their families and can't come out, like what support can we give them, or they're looked after children, how can we support them? And those of us who are getting older that are not going to have a family, how are we going to get support? Those are my 3 kind of main purposes for future. But I think another thing, as an NHS employee, many of you might identify with this. I had my mental health encyclopedia of acronyms, and then I went into physical health services, and my encyclopedia was totally useless. So I think this whole thing of the acronyms we use, the sense of, assuming that everybody knows how to navigate the services or know where to find the services. We really need platforms and places for people to go to find out how to navigate the system. Because in 16 years of working in the NHS, I still don't know all the services and systems. So I think there's something about making services more accessible, opening more doors to people to find the knowledge of how to access the right services and all the good things that are going on. Thanks.
Yes, thank you, Mary. That's great. Everybody, this is a fantastic conversation and discussion. It's just a shame that we don't have more time for this. I really, really wish we did, because I think this is really an important conversation to have. We've got what I would like to do, as we have about 10 minutes left, is for 7 and 8, maybe pick 2 panelists for 7 and 2 for 8, and then everybody answers number 9, the headlines one, if that's okay. Mira, would you like to start with 7?
Okay.
Which is, what services do you feel most confident in using? What services do you feel most confident in using or currently use?
Okay, well, actually, I'm going to answer it in the negative for a change, because I have had people I know in the community who have had mental health problems, and I, as a specialist mental health person, can't get access into those services for them during COVID. So I think that's been really difficult, and I've had to rely on informal networks like Pawan to help to get into some of the local mental health systems. I think people are overburdened. I know police, social services, NHS are overburdened, but I think this whole idea of bureaucracy above humanity really needs to change for us to feel more confident to use the services. So I guess I feel more confident using the community services. Look at COVID mutual aid. They were first off the mark, you know, and all the community groups that have set up, whether they're LGBTQ or non-LGBTQ, and neighbors and friends. So I think this idea of, you know, services being much more accessible is a really important issue.
Thank you, that's great. Sana, would you like to answer number 7? What services do you feel most confident in using, or do you currently use?
I don't want to be really negative as well. I feel like we're just like coming in off the back of Mira. I feel a little bit disillusioned at the moment with the NHS and with mental health services. I think, don't get me wrong, I think there are some really great professionals that are doing the work within those spaces, but I just think systemically how it's set up to work is you have to have a diagnosis, but pretty much to be able to get seen. And I personally have my own issues with the diagnostic model of understanding our suffering. So for me, I think the services that I feel comfortable using are private therapy with a woman of colour. And I think as you know, if a close friend of mine was to ask me for advice, I would direct them towards going to see a therapist that is a queer person of colour or a queer DSC person. You know, I think that's where I would point them towards, rather than going necessarily into standard mental health services. That's where I would come at it from.
Well, excellent, thank you. I'm looking at time. I mean, Pawan or Lokesh, would one of you like to just say something quickly as well? I do appreciate. Yes, come on.
Very quickly, actually, just a little bit of positive note to change kind of some of the things they could actually access as well. And I think that's a very good point, actually, what Lokesh has mentioned, and Mira and Sana has actually picked up. The people actually feel more comfortable if they know that they are professionals, understand what they're talking about. And we know this from the COVID-19 survey, where people have said, about 70% of people said they would like to see Black and ethnic minority psychologists or psychotherapists, for example, if they are from the same community. Similarly, LGBT people community would like to see people with LGBT community as well. So there are some support available. And I'm just going to name quickly a few of the things as well, just in case people are listening and it might be helpful for them. There's a LGBT Foundation, provides a lot of support for LGBT community. There's a Mind charity, which has a rainbow group, which provides LGBT Mind support. Samaritans is a very good listening, especially if somebody in crisis. There is a organization, NHS Mental Health Foundation. There is if you are in crisis, you still have to ask your GP to refer you to the right services as well. And again, things may be patchy at times as well. But in the crisis, you can also go to A&E because all the A&E services have mental health services attached to them, and they should be able to provide support. It's just to mention that there are services which are already existing as well, who could provide some of the support. Yes, there's a huge gap. We need to do a lot more, and we need to provide services catered to. But there are services we could probably tap in at this time as we are.
Thank you very much, Pawan. That's great. Lokesh, if it's okay with you, could we move on to the same question? Sorry, to the next question. It's just, typical fashion. We've got about 4 minutes left. Number 8. What do we? Alice, would you like to put number 8 up? Thank you. What do we need to challenge leaders with to ensure greater inclusion for those who experience health disparities? I think if we can quickly. Who would like? Can you raise your hands if you'd like to address this question? Oh, Mira. Oh, yes, Pawan, Mira. Oh, yes, come on. Quick, chop. Let's get as many answers out as possible before I get my hand slapped. Go on.
Yeah, just staying with on themes as well. That one is actually the training and education of the leaders to be able to aware of what's actually situation, and more visibility. I think we are hearing from people, actually, people connect more when they see leadership, actually, they can recognize with who are representing their community as well. So definitely leadership need more kind of presentation. And like Sana mentioned before as well, it's not just leadership, it's just awareness of those things and really getting to understand what are the different needs are. That needs to be embedded in leaders, their training for leadership as well.
Thank you. Lokesh, would you like to go next, as unfortunately we had to miss you out on the last one?
Yeah, so I think most of the decisions that are being made are made by cis white men. So what I would like to see is a better representation and involvement of people from all these communities that are suffering, so they can cater those services for themselves. Yeah.
Thank you. Thank you. I'm gonna actually ask both Mira and Sana this. Mira, do you want to go next? And then I'll come to you, Sana, as well. Okay.
I was just going to say, just to stick up for the NHS since I work in it, the NHS Leadership Academy is doing a lot to improve the BME leadership in the NHS. I've been privileged to be part of the NHS Ready Now program for BME leaders with the wonderful Dave Thornton and Eden Charles leading it. I know there's a lot of initiatives. They recognize the snowy white peaks of the NHS or the Guinness effect. And I think a lot of the organizations are recognizing it. And I think, you know, I guess it's seeing that people not just go on training programs, but actually are able to do the commissioning and delivering of services at senior levels. Because again, as I said, if we cater for the thumb, we fix the fingers problem.
Yes, thank you for pointing that. Thank you for pointing that out to me. I think absolutely. Sana,
Yeah,
we're going to push. We're going to push for a little bit more time. So you know, it's such a fantastic conversation. You know, I'm really excited by this, and it's uplifting. You know, and I think more of these conversations need to be had. Sana, go on.
okay, I'll just try and keep it quick. I just wanted to say, I think it's just, I'm going to say the F word, but basically also where the money's going, you know, commissioning what's needed rather than what's cheapest. And I think there's a lot of money been going into therapies like CBT, IAPT, which is improving access to psychological therapies, which is a lie. It's just, you know, it's trying to roll out very quick, you know, plasters, sticking on 6 sessions of therapy that are very much based on the individual as having something wrong with their cognition or the way that they're thinking. And it does not account for, you know, extensive amounts of trauma, societal trauma, so structural oppression, that actually it takes a lot of years. And the reality is actually a waste of money, because the relapse is huge, is high on people that, you know, that this, I can't pull stats exactly, but I've definitely read a lot of stuff about CBT relapse being incredibly high. So I think, you know, the money needs to be completely shifted away from what they're putting it into at the moment, what's needed rather than what's cheapest.
Thank you very much for that, Sana. I'm going to add my thought to this as well. What do we need to challenge leaders? I want us to think about the leaders of our communities as well. The leaders of our communities to ensure that there is greater inclusion for us. So I would still love to have those conversations, or those conversations go out for the LGBTQ, for the queer community, back to our communities, to have those conversations, to make their spaces, our spaces, more inclusive as well. Okay. I am going on to number 9. Is that okay with everyone? Yes, thank you. And number 9, Alice. Now this is a fun one. Describe it, and a serious one, fun and serious. Describe a news headline that you would like to see in 1 year's time. This could be a citywide headline or something more specific to you and your community. Let me start with Mira first. I'm going around the clock. Mira first.
Okay, great. This would be my headline. Services are being co-produced and unleashing the assets of the communities, identifying and applying unique solutions to their local intractable problems. That's
fantastic. Yes, absolutely. No, that's great. Very thought-provoking. Yes. Lokesh, would you like to go next? What is the question? What's the headline you would like to see?
So there are like a lot of things that I would like to see, but I think that there's one thing that I would not want to see, and that would be I don't want to see minority communities being again the ones who are most suffering in these kind of situations. So I would not want this headline to be again everywhere.
Yes, well, absolutely. Very good point. I mean, those headlines that were happening raised anxiety, and it's only my family members usually. And like I said, my father flew back from India during that time. Thank you. Sana, do you want to go next? What headline would you like to see?
I found this question really hard. I had like lots of different headlines, but I think it kind of pulls it back to underneath services. But yeah, children to be taught colonial histories and bell hooks all about love as a mandatory part of the curriculum. So basically, yeah, education around what love actually is in action from a very, very early age, and histories of colonialism. Another just side one, and this is a geeky one for me, is clinical psychology to be 88% demographics people of color. That's just like for my research. Just
oh, fantastic. Yes. That's great. Thank you very much, Sana. That's great. Pavan, what about you?
My headline would be, and we fight back against invisible inequalities.
We fight back against, okay, absolutely. Yeah.
And we fight back against invisible inequalities, and inequalities in every area. Health, we talked about people actually, mental health, physical health, the kind of accessing social care, support, all the kind of inequalities. To make it more punchy, you can say London fights back against invisible inequalities.
Absolutely, thank you. No, that's
Can
great.
I just share one statistic which I found really horrifying? So Black women are 5 times more likely to die in childbirth than white women. Asian women are twice more likely to die in childbirth. Today in 2020, really?
Yeah.
Inequalities.
Yeah, absolutely. And these are some of the statistics we don't hear. And we need to be hearing these, and we need to be pushing these forward. So thank you for raising that, Mira. My headline is going to be around, actually, doing my interviews for this survey. So I can't take the credit, but somebody put this in my mind, and I hope they're watching, you know. So I can't mention their names, it's confidential, but I hope they're watching. And they simply said, would it be fantastic, you know, the headline, if there was like, you know, temples, gurdwaras, mosques, all having lesbian, gay, transgender, and queer weddings as commonplace. And I thought, oh my God, I love that. I said, so I said, can I use that? He said, so of course you can. So that would be the headline I would love to see. Okay. Thank you for that. Oh my God, that was absolutely brilliant. I feel so energized. I'm looking through the questions, but actually most now, I think people have realized there isn't time for questions. So, but there are lots of excellent comments in here. I'm just quickly going to see through these. Good. I think otherwise we are done. Thank you. Thank you for that. That was absolutely brilliant. Is there... Sorry, I'm not reading. Promise you, I'm not reading. Was an 11th question? Oh yes, number 10. Apologies. Yes. So I have an 11th question on my paperwork, but number 10. Do you think it is possible to build back better and fairer? Yes, number 20. Final question. And I have just been told we have got time to quickly go through the room and ask everybody. Yay! So, Pavan, let's start with you this time. Do you think it's possible to build back better and fairer?
So I'm hardcore optimistic. I absolutely think it is possible. I think as a society, we have come a long way. And I mean, people have different views about how far we have come. Everybody might say that this time was better than others. And maybe statistics can help us understand the lifespan, quality of life index suggesting that things are much better. I remember going to Liverpool being in the kind of seeing in the slavery museum and being in the ship museum. There's a museum which is actually an old converted ship, to see how life has evolved and changed, how far we have come. Life expectancy has increased, and so access to mental health services are increasing as well. So things are getting better. We need to continue in this journey. We need to continue this dialogue. We need to have continuous communication. Of course, certainly we can do that.
Absolutely. Thank you, Pawan. Absolutely. Mira, would you like to go next?
Yeah, I mean, while I've been doing my Darcy Fellowship, I did a kind of snapshot of the system during COVID, like all the services in that borough. And one of my favorite quotes was, "COVID has been a wonderful laxative to the system." And it has been, because it's broken down a lot of the bureaucracies, a lot of the governance, and it's created solutions. So I think you could see COVID coronavirus as a shaking up of the old order, as everyone having to reflect and question what we're doing and why we're doing it. And maybe it's a time of massive trauma and difficulty, but also a massive time to reshape services and to look again at how do we design things in an out-of-the-box way of thinking, like the NHS volunteering, like the Good Sam, like co-production. So it's a time of opportunities and growth. Like Pawan, I'm positive.
Thank you. Absolutely. That's great, Mira. Thank you. Sana, would you like to go next?
Yeah, I mean, I think I just add to what Mira said. I also agree. I think it's a real opportunity for transformation, and I think it's a very painful one. But I think any change comes with a lot of discomfort, and any growth comes with great discomfort. And I think right now we're being forced to confront and look at the unveiling of what was already there, that is just laid bare in a way that we can't turn away from it anymore. And actually, I'm very, very hopeful for a lot of change, and I think things are already happening, even though it's very painful. So I'm just hopeful. I'm hopeful for what comes next.
That's great. Thank you. Lokesh.
I think it has always been possible to make it better and make it fairer. I think the COVID has sort of given a slight boost in certain areas and also dragged it back in certain areas. So I think it'll be a challenge to catch up in those specific areas, I would say.
Okay, that's great. I'm going to push. We've got a few more minutes left, so I'm going to put one more question out to everybody, if that's okay. But very quickly, do answer about 30 seconds each, okay? And before I do, I also want to say that on Tuesday we have got the discussion for our Latin brothers and sisters, also addressing the same issue. So that's Tuesday. Gloria, thank you for reminding me. But we have this very important same discussion for the Latin LGBTQ community in London. Okay. So final one, very quickly, we've got 30 seconds each. Would you, Alice, do you want to place number 11 on there, which is there a piece of advice? Okay, I'll read it out. Is there a piece of advice you would like to give to anyone watching this in the chat or in the future? Any piece of advice you would like to give to people watching this or in the chat? Give you about 3 seconds to think about that. Okay. Any piece of advice? Let me start with who should I? Sana, you're smiling away, looking very confident about the question. Go on.
I think I don't want to be too cheesy about it, but I think what comes to me is like, how are you forgiving yourself? I think that we're all carrying, especially in these communities, I think like Pavan mentioned, a lot of sharm, and that isn't necessarily ours. I think we're taught a lot of sharm, and unlearning that is a really, really difficult process. And I think a practice of self-compassion is so important. So my advice would be how are you cultivating forgiveness and compassion with yourself on a daily basis? Because that's the foundation for any loving relationship with anybody else. So that would be my advice.
Absolutely, thank you. And I would love to have a discussion on sharm and shame as part of one of our next events we'll do in June. Okay, thank you. Pavan, would you like to go next?
Sure. I think from what I have experienced in the mental health profession is that one of the key risk factor for people to develop mental health problems and not getting the support or move on from a mental health problem is loneliness and isolation. It's a one big factor we have identified in many researches and evidence as well. So based on that, I would say, like many people have suggested for my better mental health need, connection is key. But I would add on to that, it's actually not just connection, it's holding connections. It's the connection where you can really feel that the person can hear you, listen to you, and understand you. Cultivate those holding connections and build on.
So you absolutely, really good points there, Pavan. Thank you. Mira, would you like to go next?
Yeah. So as we're addressing the Asian LGBTQ community, I would say we're all pioneers. We're really courageous, going through the darkness and the hopelessness and the loss and the trauma and the suffering. And we're here to tell the story and be the change we want to be. I mean, I had a Hindu wedding 7 years ago, the year it became legal. So, you know, there is light at the end of the tunnel. There's a lot of us here to support all of you on your journeys, wherever you are in UK or abroad. So please reach out to us. And I'm trying to set up a women's space as well. So come along, women, to Rangila Parivar.
Thank you. That's so uplifting. Thank you, Mira. Lokesh, would you like to say something?
I would just add that I think like everyone needs to just understand that their experiences and the things that they go through are valid, and like comparing it with others won't like doesn't make it less valid. Like your experiences are valid, and being able to address those and seeking help if you need is a good thing, and they should do that.
Thank you. That's absolutely fantastic. That's great. My comment, as we've got about 2 minutes left, I'm going to be rounding up. My comment would be like, you know, there are some fantastic LGBTQ South Asian organizations really working hard. And I don't put so I've missed any out, but I will certainly mention Hidayat and Serbat and Iman and Naz and Matt and the Naz Project, Queer Asia, Jing, the Gained Network ourselves. I do apologize to any group that I may have looked, but you know what? They're doing a fantastic job. Do reach out to them, do reach out to us, because by building this community, we can really support each other and help each other. You know, we're more social and fun kind of group, but there are support groups as well for the South Asian. Not enough, and we need help with that. And these surveys, hopefully, will help focus some of the people in authority and leaders to able to focus, give a little bit of their focus on us. Unless we push, unless we do this, massive thank you to Brixton Reel and Alice as well for managing this for us. It's been a great event. The fact it's gone so fast and so quickly, I've thoroughly enjoyed it. It's been exhilarating. You know, Carrie, a message for you. Can we have more of these? It would be fantastic. Thank you. So namaste. Thank you everybody for joining. And as Spock would say, live long and prosper. Bye. Thank you.